The CDC releasing its long-awaited guidelines for schools and businesses to use as they emerge from lockdown. But as states reopen, will people continue to adhere to social distancing policy, or will human behavior rear its ugly head? Joining me now to discuss, District Media President Beverly Hallberg. Beverly, I want to bring your attention to this video. It caught my eye on Twitter. It's from Florida. Take a look.
Florida was one of the last states to close down and one of the first states to open up. And while the rest of the country is still freaking out, especially in blue states, look at this. I'm at a bar, restaurant. We're all having a good time. Not a single face mask. It's not that bad, guys.
I got to tell you, Beverly, and it's not just there. There are places all over the country, all over the world, where people are saying, I want out. I want to get out there. I want to be free. Now, of course, maybe if Fauci saw that video, he would cringe because people were standing so close to each other. But that's human. I mean, it's going to be difficult to really contain human behavior, isn't it?
It is, and I think this is largely due to the fact that we haven't had clear messaging of what we're trying to achieve. You just mentioned Dr. Fauci. A few weeks ago, he said that masks weren't important. Now they're apparently imperative or essential for us to have. We were then told we just need to shut down until we flatten the curve. Now it seems like for some areas it's this indefinite thing that businesses have to be closed for the foreseeable future, even though we know a vaccine is not going to be developed anytime soon. So I think the fact that there's partisan media out there, I think that we're being presented with this binary choice. Either you stay at home or you don't care about people's lives. Even on Twitter, Grandma Killer was trending this week for people who want businesses to get back. So I think for many Americans, they're taking their health into their own hands. Some think it's more concerning than others. And I think we're going to have a varied response across this country.
The day the Michigan sentiment number was released, and there's all kinds of sub surveys in there. Here's the thing that caught my eye the most. Of your pandemic concerns, health went from 61% to 57%, finance from 22 to 17%, social isolation rocketed from 14% just a month ago to now 21%. People it's part of this need to be out there. I mean, not just financial, just simply a need not to be alone.
Yeah, I think there's a lot of loneliness going on. There are a lot of studies. I think it's going to be fascinating when the psychological studies come out after all of this. People are really struggling. But when you talk about businesses, the aspect of small business, I'm in Washington, D.C. They just extended stay-at-home orders until June 8th. A lot of businesses are going to be shutting down between now and June 8th. And so I think a lot of people are saying, look, this virus is going to be around. We have to find a way to try to stay as healthy as we can, but also realize that economic livelihood matters as well. It is a health concern if people lose their jobs. The president mentioned today that suicide rates are going to go up, depression is going up, and so getting this economy back is important for health, and I think Americans realize that.
We talk health, financial health, and more we're going to be talking about mental health. Beverly, great seeing you. We'll talk to you again real soon.